Welcome to the Clinical Academy Malignant Hyperthermia video simulation. This activity provides an opportunity to observe best practices related to recognizing and responding to a malignant hyperthermia crisis. 6 video clips will be presented. Please be sure you have your companion workbook available to complete in between video clips. At the conclusion of the final video clip, you will be prompted to debrief. Before starting this simulation, make sure you have scheduled your MH debrief session with your educator or facilitator. During your debrief session, you will discuss local policies, equipment, response, and workflow.
Good morning.
Good morning.
My name is Ashley.
Hi.
I'm going to be your nurse today in the operating room.
Okay.
And my name's Hannah. I'm going to be your nurse anesthetist.
Hi.
We're going to be the team that takes care of you today.
Okay.
Do you go by Malcolm?
Yeah.
Great. I'm just going to go over your consent and a few questions with you, and then anesthesia has some more.
Okay.
May I take a look at your name band?
Of course.
What's your first and last name?
Malcolm Hendricks.
When's your birthday?
November 11th, 1998.
Perfect. So what are we doing for you today, Malcolm?
I'm having a hernia surgery.
Great. Did someone mark the site?
Yeah, they did. They put their name on it, I think.
Perfect. So Malcolm, when was the last time you had anything to eat or drink?
It's been like forever. I had an early dinner last night, so haven't had anything since then.
Okay. Anything this morning? Any medications?
No meds.
Okay. How about any allergies?
Well, I have like hay fever. I don't know if that counts.
Okay, but nothing to medications?
No.
Okay. Have you ever had surgery before?
Yeah, for my appendix.
Okay. Anything implantable in your body?
No.
Any metals? No? Anything removable?
No, I had braces when I was little.
Okay, great. I'm going to hand off to anesthesia here, and she's going to ask you a few more questions.
Okay.
I'll see you in there.
Okay.
Thank you. Hi, my name's Hannah again.
Hi.
So I'm going to be working with the anesthesiologist, Dr. Jones. I just have a couple more questions to go over with you, okay?
Mm-hmm.
So you said you had anesthesia before or surgery before. Any issues with the anesthesia?
No, I mean, I was asleep, but I don't remember anything else.
Perfect. Or anyone in your family had any adverse reactions to anesthesia?
Well, I definitely haven't. I'm not sure about the rest of my family.
It would have been like a high fever or an extended hospital stay because of anesthesia, or maybe even death from anesthesia might have been called malignant hyperthermia.
No, I've never heard of that.
No? Okay, good. I just have a couple more questions about your history. Cardiac-wise, no heart attack before.
No.
And then no blood pressure issues, no asthma.
No, I don't take any medicine.
Good, okay. All right, Malcolm, we're just going to get you drifted off to sleep here, okay? All right, pushing paralytic. Start feeling sleepy here, okay? We'll take good care of you.
Are we ready to time out?
Ready?
Yes.
I'm Ashley. I'll be your circulator.
I'm Dr. Smith, general surgeon.
I'm Hannah with anesthesia.
I'm Carmen, I'm the scrub nurse.
And we have patient Malcolm Hendricks, birth date 11/11/1998.
That matches the armband.
Great. We're consented for right inguinal hernia repair. Is the site marked?
Site is marked.
Any allergies?
No allergies, just hay fever.
Antibiotics?
2 grams of Anzef is in.
Any concerns?
I did have a little masseter rigidity with induction, but it's resolved at this time.
Are we okay to proceed?
Yes.
Okay, knife please.
Is everything okay up there? I'm experiencing some tachycardia, and I'm noticing my end tidal is rising.
Is there anything I can do for you?
He's fully relaxed. I've treated pain. I've deepened his anesthetic. I've got some fluids going, and I've adjusted his ventilations, but he's continuing to be tachycardic and his end-tidal is continuing to rise. I'm noticing his temperature is starting to increase as well. I'm concerned this might be MH.
I'm gonna call for some help.
Do you need me to do anything?
Hi, I'm calling from Sim General. I have a patient here we believe is undergoing malignant hyperthermia.
I'm turning my agent off, turning my flows up. I'll change this filter. I'm gonna switch to propofol.
And we're gonna cover the incision.
And standing by, I need you to grab ice.
I have the charcoal filter, and I'll go ahead and draw an ABG.
Can I get the Sotazorb? A new Sotazorb absorber, please? Filter is on. We have a new absorber.
I'm drawing the first ABG and first set of labs. Can you send these to the lab?
I'll take these to the lab right now.
Here's 20 milligrams of dantrolene.
Perfect. 20 milligrams of dantrolene is going in.
Here's the 10th syringe
Thank
for
you.
200 milligrams of dantrolene sodium.
Last syringe of dantrolene is going in. We're at 200 milligrams total.
Dr. Smith, I need you to place a 3-way urinary catheter.
Okay. Anesthesia, can I have you please take the drape down, and would you mind grabbing some cold saline for installation?
I need you to grab cooling agents.
Okay, I'll grab the ice. Here's your chilled saline.
Chilled saline.
And I have your ice here.
Thank you. Ice is on the neck.
Cold saline for irrigation.
Okay, I'm pulling some up here. Okay. Do we have lab results back yet?
In this scenario, roles were assigned using colored roll cards. The flowchart indicates the tasks that were assigned to each individual. This is an example of best practice.
Thank you everybody for coming to this debrief. We're here to talk about our patient, our 20-year-old male, Malcolm Hendricks, that we performed a right inguinal hernia repair for. You guys did a great job.
How did the patient do?
You know, he's doing well. After 2 days of supportive care and therapy, he was discharged and he's doing fine.
What do we think went well with this malignant hyperthermia case?
Well, we had clear established roles.
I think we had good closed loop communication. It was very helpful from an anesthesia standpoint.
And we used those delegation cards, which really seemed to help with our communication.
And there weren't a lot of people in there that there was so much noise we couldn't hear each other communicate and use that closed loop communication?
Okay.
I recall you saying there was some masseter rigidity upon induction. I thought an increased temperature was our first sign of malignant hyperthermia.
Actually, increased temperature is a later sign. Earlier signs, masseter rigidity is definitely one of the signs, but tachycardia and increasing end-tidal CO2 are the early ones.
Should we have done something when we noticed that rigidity at the start?
It's not always present, but I think we did a good job of verbalizing that we saw it and then just continuing to monitor our vital signs.
I think really just the combination of all of them together is the key thing. The masseter rigidity, the tachycardia, the hyperthermia are all signs together that kind of pointed us in the direction of it being malignant hyperthermia.
So what are some of those triggering agents?
Succinylcholine is one of them, which is one that we used on this case, as well as volatile agents including sevoflurane, desflurane, isoflurane.
What could we have done with our incision site? Should we have left it open?
It's okay to leave it open just because they are very rigid, and it's also an opportunity for us to provide some cooling.
Are there any other medications that we can use to correct this other than the dantrolene?
Like you said, dantrolene is definitely going to be the most important.
And then just supportive therapies, if they have hyperkalemia, we're going to be treating that, watching their vital signs and treating based off of that, as well as getting their labs and giving agents to replace those.
Was there any paperwork that we needed to follow up with on this patient?
I did submit some paperwork with M-House on this patient.
and I was able to fill out an incident report, and all of this is clearly documented in this patient's chart.
This was the first time that I'd ever taken part of a malignant hyperthermia event, and I think that everyone did a really good job, especially to hear that the patient had such a positive outcome, and we did all the right things. I think we worked really well as a team together.
I agree.
I agree. Thank you for taking the time to debrief. I think this was really helpful.